Good morning and welcome to the Point. It has been more than a month since the first cases of the coronavirus were discovered here in the state of Michigan, and a lot has happened between then and now, including this week, when the emergency declaration was extended until the end of the month, and the governor said she was also extending the stay-home order. She told us she would do that on Wednesday. On Thursday, she announced her plan. But when we talked on Wednesday, here's what she had to say about why she thought it was so important. When you think about that stay home, stay safe order, we've had a lot of people question what is essential. I talked with the speaker yesterday and he said maybe we need to start thinking in terms of what is safe, maybe not what is essential. But you've been pretty clear that you want this to include as many people as practical. Can we expect that it's not going to be a matter of loosening who can go to work, but a matter of continuing trying to keep as many people at home as possible?
Well, I think, Rick, you'll see that the order reflects all of the statements of the epidemiologists and the medical professionals who I think we all should be listening to, frankly. You know, it's easy to think through scenarios where maybe something seems less risky. But the fact of the matter is, the more people that are out and about moving around, the more people at the gas station who pick up that nozzle and fill up their car, the more people that are going to be affected by this. And that's precisely why it's really important that we continue to do what we've been doing, to double down on these mitigation tactics. We know that it's worked in other states that have been confronting this longer. The governor of New York has made some observations to precisely that it looks as though they've been able to flatten the curve. You know, to the extent that we impact making fewer people have to go into the hospital or fewer lives lost, and shortening the amount of time that we'll confront this as an economy is better for everyone. And that's precisely why I listen to the scientists first and foremost as we make decisions about public health.
Where do you think we are on the curve? And I know we won't know probably until we get past and can look at all of the data, but do you think either because of information that you're getting from the medical experts or even anecdotally that we have started to flatten that curve or push it down a little bit, or when will we really know?
Well, I think that's the difficulty here. We've never had enough tests. This is a frustration that we're not alone. The whole country is feeling this. And in order to really have confidence in the numbers and the modeling, you have to know how prevalent COVID-19 is. And I think that's an issue that makes it much more difficult to, with any confidence and accuracy, say our peak is going to be on this particular day. The Trump administration is looking at, kind of nationally what they think peaks are going to be. We're looking at what's happening here in Michigan. And when we talk to our researchers at the University of Michigan, we think that it's closer to the end of the month when Michigan's peak will be. It will be different in different communities across Michigan. And so to really be able to pinpoint one day where it's going to be the worst and then it's going to get better every day after is not something that we're able to do with a lot of confidence. But what we do know is that social distancing works. We do know that the more people that abide by this order, the fewer are going to get sick. The more nurses and doctors are going to be able to do their jobs and have the PPE they need to adhere to and the standards, but also to take care of the people that need their help. And that's why, even though it's a sacrifice, it's on every one of us to do our part. In your household, two people can get COVID-19 and react very differently. One can feel like it was a mild flu, and for the other, it can be fatal. We don't know how our individual bodies are going to react to it. Some people might be carrying it right now and have no idea. And that's precisely why these mitigation strategies are the most important tool that we have in this invisible threat to all of our health.
When you talk about having the right amount of equipment for hospitals and those frontline workers, you talked about PPEs, we know we've talked about ventilators. How are we as a state prepared for this oncoming surge, this getting to the top of the curve compared to where we were, say, 4 weeks ago when this started?
Yeah, so we've really ramped up. I think that knowing that the national stockpile was not going to be able to meet all of our needs, we mobilized our state emergency operations center, and we've been procuring equipment from around the globe. We've got great Michigan businesses that have stepped up, that have started producing, instead of alcohol, hand sanitizer, or instead of cars, face shield for our medical providers. Each of these helps us meet the requirements for our nurses and doctors to keep themselves safe. We know, sadly, that these frontline professionals, these superheroes that walk among us every single day, are exposing themselves to great risk just by being in the hospital with COVID-19 patients. And that's precisely why we got to make sure they've got the tools to protect themselves so that they can keep caring for patients. So each of these has been an important component to making sure that we're able to meet the need. A week ago, we were living about day to day. In some hospitals we were. Today, most hospitals have 3 to 6 days worth of PPE. Now, that's great. I mean, that's much better than where we were, but that's not enough. And so we've got to continue our efforts on all of these fronts.
Earlier this week, you had some stunning numbers when it came to unemployment claims. And we know that people are really frustrated about the difficulties they're having getting through to the system. And you expressed some of that same frustration because obviously you've changed the rules and allowed people who otherwise wouldn't have been able to get unemployment to do so. But the system is overwhelmed. Can you share some of those numbers with us again, just because they were really overwhelming?
Well, I had my notes in front of me, but I'll tell you this: the number of claims that we are getting right now, it's a 4,000% increase from what we were getting 2 weeks before COVID-19 made itself known in the state of Michigan. On a day, we get more people applying for unemployment than we did for weeks during the Great Recession in over 10 years ago. And so I share these with you because it just shows you that there's so many people that are unemployed right now, and it's been a huge pressure on the system. Now we've rebuilt the system. We've quadrupled the number of people that are working to answer phones to help people navigate it. But when you could quadruple the resources and you've got 4,000% increase, you know that it's still going to take some time to make sure everyone's navigated it. Now, acknowledging this and how difficult these times are, I cut a bunch of red tape. So some of my executive orders made it easier for people to get some help. We extended unemployment so they'll get more help when their claim is done. I've made it so that you don't have to file it within a certain period of time in order for your benefits to accrue. That means, the clock, if it takes you a little bit longer, you're going to be okay. You're still going to get the unemployment that you deserve. And then also, we just made it easier so that you don't need to have all of the paperwork that we used to require from your employer. So we're working to make it easier for people, to make it sure that people get access to additional benefits. It's harder to navigate right now, but we're working to, address that as well.
Earlier in the week, the legislature extended that emergency declaration to the end of the month. The governor wanted another 70 days. We talked with State Senator Rick Outman about the experience of being tested for a fever and putting on masks to go into the chamber to cast that vote.
Well, certainly different. I mean, it wasn't the hugs and the handshakes and everything that you would figure on having after, an absence of any certain amount of time. But it was a safe process. We were screened before we went over to the Capitol building. They took our temperatures, asked some screening questions, requested that we wore face masks. It wasn't mandatory, but most everyone complied. And of course, social distancing. And it was a very limited amount of time. We were just there. We did what we had to do and got out of there. I'll bet it wasn't a matter of 10 minutes. So, it was probably safer than going to the grocery store, but something we felt was necessary.
Well, one of the things that was important to do from the standpoint of the legislature was to weigh in on the expansion of the emergency declaration. The governor had asked for 70 days. You and the legislature decided through the end of the month. Tell me about the process of coming to that decision, because obviously there were a lot of different points of view. And by the way, there were some people who wanted to do it even shorter than till the end of the month.
It was certainly a compromise between those that wanted the shortest amount and the governor who wanted 70 days. We felt that a blanket 70 days was really sending the wrong message to the public that we were going to be locked down, even though she has the ability to lift it anytime during those 70 days. We think it needs to be in shorter durations. As this pandemic continues to evolve, things happen overnight, and we know that things can correct themselves overnight too. And there's certainly a lot of speculation on whether we should have a blanket shutdown anyway. So we thought we needed to weigh in and express our concerns.
Let's talk a little bit about what the state has already done. There has been a significant amount of money that has been dedicated towards fighting this pandemic. Do you anticipate, with the loss of revenue the state is going to have and with the continuing needs, that you and the legislature are going to have to do more on the economic side when it comes to this crisis?
Well, we're certainly looking at what comes to the state via the federal stimulus package, how much of that money goes to us directly, how much of it goes to hospitals and other COVID response teams. And so as we wade through that, that'll determine how much more money that we have to put forward in a supplemental. But certainly we're looking at negative supplementals because I think the projections that I have or that I've seen is for our 2020 budget alone, it's going to be anywhere from $1 to $3 billion deficit. And for our 2021 budget, anywhere from a $1 to $4 billion deficit. So worst case scenario, we could be a $7 billion deficit budget. So a lot of that is based on our January revenue estimating conference. Of course, we have another one in May. We would have some firmer numbers in May had we not extended the filing deadline to July 15th. We would know a lot more. A lot of it's going to be based on projections now, and so much of it is based on how long this shutdown lasts. But we're certainly working on it, and I'm involved on the DHHS approach committee, and we have probably every other day committee meetings via Zoom, or not committee meetings, but work groups, just going through the budget.
Well, and DHHS is such a substantial part of the budget. That's where the pressure will be for spending and also for financing. So, I mean, how difficult is it going to be to put that big budget together, even understanding that a lot of that is federal?
We had a lot of hopes for, as our revenues were continuing to increase with the good economy that we had a lot of hopes for restoring or even improving some programs, and it looks like we're probably going to go backwards on a lot of it. But, again, a lot of it's based. We're just working through it.
At the state level, the emergency declaration and the stay-at-home order have both been extended. So what's next? At the federal level, $2 trillion has already been allocated for coronavirus relief. Much of that has not yet made it down to the states. We'll talk with U.S. Senator Gary Peters about the possibility of even more federal help and something he wants to do to help those on the front lines of this battle. That's all next. To the Point. Welcome back to the Point. We've been talking about the government response to the coronavirus, COVID-19. We told you a little bit about what's happening at the state level, but at the federal level, it is a much bigger picture. U.S. Senator Gary Peters has a plan for helping some of those people on the front lines of this battle. He talks about that and what the next response from the federal government could be.
This has been a very intense few weeks, and certainly focused on making sure Michigan gets the supplies that we need here. I'm ranking member of Homeland Security. I oversee FEMA. FEMA, of course, is entrusted with the federal response. And I'll say we have two challenges there. One, we have inadequate testing. We don't have enough tests to test the folks that we need to test to get a better sense of who's sick and who's not. But right now, the number one problem is personal protection equipment for our healthcare providers. There is a scramble to get more of that. We need to get more of it here in Michigan. And I've been on the phone regularly. My staff working with FEMA every single day, and trying to really make the case that right now we know we don't have enough personal protection equipment for everybody in the country. But some areas of the country are not impacted to the extent that we are here in Michigan. And we are basically in a triage situation. If you can't get equipment everywhere, then get it to the folks who are the sickest and the folks that you can help. And clearly Michigan is in that category right now. So we're trying to bring more and more of those supplies to our hospitals here all across Michigan.
What do you hear back from FEMA? I mean, I always am interested in what those conversations must be like, because when you call up and say, look, you know what the numbers are, you know what we're going through here in Michigan, and then what is their response? Do they not have the equipment, or what do they say?
Right now, I mean, the response is that there's just not enough PPE to go around. They're ramping up production. We're starting to see more production starting to come online. You look at Michigan companies right now, from General Motors and Ford and Chrysler, are going to start making masks and respirators. You're seeing smaller companies and others all across the state. In West Michigan, you've got companies that are saying, we don't normally make masks or respirators, but we think we can do that. They're starting to come online. So we're seeing the Americans and the ingenuity of Michiganders to come up with equipment and starting that production. But that still takes time. You can't just turn a switch on. So in the short run, we have to rely on what supplies are out there and where the stockpile. And the stockpile has basically been depleted at this point. So it's about trying to bring in more of these supplies from overseas. There's an air bridge that's been established now with aircraft that are flying around the world trying to find personal protection equipment. The problem with the pandemic is that there are a lot of other countries that are doing the exact same thing. So as we are waiting for production to really ramp up, which it will, but it'll take a few weeks to happen. In the meantime, it's certainly what I'm fighting for is to make sure it's going to those places that need it the most. In Michigan, we're one of those places that needs it the most, and we've got to continue to see more come in here.
You talked about ramping up, and people here in Michigan particularly, we've heard this described as a warlike footing, because there is a battle going on against this virus, and people hearken back to the arsenal of democracy. But in very real terms, that is happening in Michigan when you see these giant auto companies completely shutting down their lines and doing other kind of production. But there are some other people that have really stepped up, and those are the first responders, people on the front line of this, obviously the hospital workers, all of the people who are dealing with those who are the sickest right now. And you have proposed an idea that will make it a little easier for them if it comes to fruition. Let's talk about the HEROES Act.
That's why I've proposed the HEROES Act. The HEROES Act deals with folks who are in absolutely essential jobs. We need them to do the job every day. But they're also putting themselves into harm's way. They're being exposed to the virus and doing the job that they must do for us to carry on. And certainly they get our thanks, but I also think they should be compensated for that additional risk, similar to what we do in the military and other places for hazard pay. And as an example, we certainly think of our hospital workers. There's no question our doctors and nurses and technicians are heroes. They should be compensated for taking some additional risk. But it's also the folks who are in the custodial staff in that hospital. They're the ones that are in that hospital. They're exposed to additional risk, but they have to be there. They have to keep everything clean. They have to sanitize things. Think of our folks who are in our grocery stores. For those of us who can work from home, or those who are sheltering in place and have the ability to do that, it's absolutely essential that we have somebody in the grocery store stocking shelves and the supply chain bringing food into that store so that we can go out periodically and load up food so that we can stay in our homes. Think of folks in pharmacies, the ability for drugs and medicines. And when those medicines are delivered, think of our postal workers who are out there also in the public. So the HEROES Act will provide additional pay to those folks who are in essential jobs and folks who have to interact with the public on a regular basis, which means that they're exposed to the virus. And I think they deserve our thanks, clearly, but they also deserve additional compensation for taking on that additional risk for themselves and their family.
And finally, Senator, I know that the legislature, the administration came together on a $2 trillion package. shortly after we started being bombarded by the coronavirus, but many are saying now that both from an economic standpoint and from a health standpoint, there may be a need for more to be done at the federal level. Is that something you're hearing any conversation about? And if so, what are you hearing?
I do believe that we're going to need to do more. This the last one, the CARES Act, over $2 trillion. It was the third bill that was passed to deal with the COVID-19 crisis. But I think most of us realize there's going to need to be more done. Part of what we're looking at now are where are the gaps that were not covered under the CARES Act, where additional resources may be needed, for example. And I think there's some areas that are already becoming apparent. One, our healthcare facilities are going to need more resources. Our hospitals are stressed. I've talked to them on a regular basis, and CEOs and other folks who are saying that the financial strain on these hospitals is significant. And when they get through this crisis, they may have a hard time going forward, especially our rural hospitals. But all of our hospitals are going to be under significant financial strain. We did provide $150 billion for hospitals and healthcare providers across the country in this act. We think we're going to need more. I think our small businesses are going to need more resources too. We've got ways in which small businesses can loan money and have that money forgiven if they keep people on the payroll and are covering expenses. We know that for us to get out of this crisis and to get the economy moving as quickly as possible when we get out of it, you have to have small businesses. If they go out of business, if they lay off folks and can't reconstitute themselves, the recovery is going to take a whole lot longer. So it's absolutely critical that we make sure that we're helping small businesses in our communities stay alive so that when we get through this crisis, they can get up and running as quickly as possible.
In the coming weeks, we will continue to keep in touch with our state and federal elected officials to find out exactly what's next from their standpoint as we all change our lives because of the coronavirus. I'll be back with final thought. To the point. It's been over a month since we've started to feel the impact of the coronavirus, and we'll continue to keep you updated every Sunday morning as we talk to your elected officials here. To the point.